Okay, so you're here because you're wanting to lose some weight. So let me go over our program, and at the end of this, if there's any questions that you have about our nutrition, our what's included, the peptides, please feel free to ask us in our consultation. So part of our program includes nutrition, right? 90% of the time, you're gonna have to have some nutrition on board to be able to maintain weight loss. So I do give you a list of foods. It's a list of foods. There are some portion sizes on there, but initially I tell people, eat anything as long as it's within this list. Why do I say that? Because we want something that's going to be flexible, that you can go out to dinner, that you can go to somebody's party and know exactly what you are able to eat and feel like you have some freedom to choose what you want. The list is very simple. It's very flexible. There are carbs in there. There's rice, there's potatoes, there's fruit. There's a lot of foods that you probably don't think you're supposed to be eating, but you'll be able to eat it. Initially, I just tell people again, eat whatever you want. As long as it's within this list, you'll be totally okay. The next part is, in our first consultation, you're going to get weighed and you're going to get measured. This is just for us to have a baseline. Every visit is going to be every 4 weeks, and every 4 weeks I will be weighing you as well, just to kind of keep track of your progress. Now, in every visit, you'll also get a fat burner. The fat burner is a combination of B12 and amino acids. This medication is not going to interact with any other medications. You're not going to feel jittery, nothing like that. It's very natural, very safe to use. So you'll get that every month when I see you for your consultation. Okay. And the most important part is our peptides. So what are peptides? Peptides are something our bodies naturally produce. And so now we're able to basically boost those levels and use it to our advantage to help with certain functions in the body. So one of the ones that we have is called semaglutide. Semaglutide is a once-a-week injection. The way that it works is that it slows your digestion, meaning that the food is going to stay longer in your stomach while it's digesting. So what this means is that you'll feel full longer. Your portion sizes are more than likely going to be smaller because you're just not going to be as hungry. Now, what that tells us is that when you do eat, you should be eating better quality foods, and you want to include protein in every meal so that you feel full and satisfied for the rest of the day. Semaglutide is a once-a-week injection, so I provide you the injections, you do them at home, okay? The safest place and easiest place for people to inject this is just on their belly, okay? There's no right or wrong way of doing it. Nothing's going to happen. On the belly is pretty safe. The peptides are going to be already pre-filled, meaning that they are ready to go. All you got to do is open the cap and inject it. The most common side effect of semaglutide is that you could have a little bit of nausea. Now, why are we feeling nausea? Nausea is happening because either you are overeating, right? So you're full and then you're eating, or you're eating the wrong foods. So you will notice when you start this program and you start these injections is that you'll feel the need to try to eat better foods, which is great, right? We want to establish better eating habits. So the nausea is not necessarily a bad thing, in my opinion, because if anything, it's going to trigger that thing to tell you that you're overeating, right? Most of the time, most of my patients will feel that in that first week when they just started the semaglutide and they think they can go back to eating whatever they want to eat in the same portions that they were eating before. Usually they correct that, and after a few days, they stop feeling the nausea. If for whatever reason it is excessive nausea, abdominal pain, anything like that, please contact our office so that we can recommend some other things for you. Sometimes we can give you a medication just to help with the nausea. But if it's something that's more than that, then it definitely is good for you to bring it to our attention. Another common side effect of this medication is constipation. And again, this is because it's slowing the digestion. So if you already struggle with constipation, just make sure you're consuming enough fruits, vegetables, and water. If this is something that's new for you, usually this tends to pass. If the constipation were to get really bad, let's say that it's been 2 to 3 days or more that you have not gone to the bowel movement, then I suggest getting a stool softener or a laxative over the counter. Okay, the next peptide that we have is called CJC. CJC is used at bedtime. It has some extra benefits for you. You can improve your metabolism, increase fat burning. It also has really good recovery benefits. So like if you're exercising, it's going to help with muscle recovery. It's going to help you get deeper sleep, which is super necessary for good weight loss. And the medication is used at bedtime every day, Monday through Friday. You skip the weekends. It's a tinier dose, but it is done every day. Most common side effect of CJC is feeling of flushing. So flushing is you'll feel like this heat like to your head. You'll feel kind of like your face is hot or red. And that tends to subside after a couple of minutes. Perfectly normal side effect, and it is safe to use in combination with semaglutide. We do have patients that use both peptides. We have patients that use one peptide. One of the most common questions that I get is which one's going to work the fastest. What's going to work the fastest is you sticking to your nutrition and using the injections consistently. So whether you do one injection once a week or you do the injections every night or you do both, just stick to it, do your work, and you're going to get the best results. Our average weight loss is about 8 to 10 pounds per month, and that is both people that are on just one injection and people that are on both. Just to recap, we have two peptides. Semaglutide is a once a week injection. CJC is a once a day injection, Mondays through Fridays. We do include a nutrition guidance. You're going to get a fat burner every time you come in. I see you every 4 weeks, and at the 4-week mark, we can determine whether you're going to stay on the same dose or you're going to increase the dose depending on how you're feeling and the results you're getting and your goals. If you have any other questions specifically about our program, please let me know in our consultation. Have a good day.